Okay, so good evening, everyone. On behalf of INACSL, North India region Vidyanta, I warmly welcome all the participants to the third and final session of our webinar series, that is Assessing Competence Through Simulation, that is simulation-based assessment of nursing colleges. Over the past 2 months, we have explored the foundation of simulation based assessment and strategies for designing meaningful experiences. Today, we focus on critical aspect of competency based assessment, ensuring that our assessment practices are standardized, valid, reliable, and well documented. We are honored to have with us estimated simulation expert and educator Dr. Jack as our guest speaker for today's session. And I hope I'm audible to everyone. If you're not able to hear me, you can just let me know. Okay? Dr. Jack is the chair of INACSL Thailand region and a lecturer at the Faculty of Nursing and Allied Health Science, Thailand. He holds a Doctor of Science in Nursing from the University of Osaka, Japan, and is widely recognized for his contribution to simulation based nursing education. Dr. Jack has received prestigious recognition, including the Realistic Scenario Award and the Popular Vote Scenario Award for Excellence in Simulation Design. He served was as an advisory member for the Army Nursing College Virtual Simulation Skill Training Center and is also active member of the Canadian Alliance of Nurse Educator using simulation. His research interests include simulation and debriefing method for virtual dementia care games and the effectiveness of simulation program in preparing nursing students for license examination. We are truly privileged to learn from his experience and expertise and international experiences in simulation based education. Without further ado, it is my great pleasure to invite Dr. Jack to deliver today's session on standardized to sustain validity, reliability, documentation. Dr. Jack, thank you for joining us today. The virtual platform is now yours.
Thank you very much for a nice introduction. So now I would like to share my screen. Can you see the big screen? Wait a minute. Can you see a big screen? It's okay.
Yes, sir.
Okay. Good evening, everyone. First of all, I would like to thank you, INACSL North India League, especially Dr. Jaidev, who invited me to this wonderful webinar. And today, you can call me Jack. Actually, right now, I'm the chair of INACSL Thailand League and also the lecturer in the university in Thailand and also the simulation director at my university. So today, I would like to share and talk about the standardize to sustain validity, reliability, and documentations. To make the most of our 1 hour together. Oh, sorry. Okay. I have mapped out our journey into 4 distinct parts. The first part, I will lay the groundwork by discussing about the simulation design and standards, for examining why variation is the enemy of fair assessment. Actually, in this part, I would like you to know about the standard of best practice about scenario design by INACSL. I think most of you will familiar with the standard of best practice of the INACSL that maybe like contain about 10 chapter, and in the year of 2025 they updated for 4 chapters. But for the scenario design, they still use the published in 2021. And in this part, I will talk you about what is the criteria to meet the standard, to meet the scenario design. And after that, for the second part, I will discuss about validity. For ensuring our scenario actually measure what they claim to measure. As you know that they will have like various types of the validity, such as content validity, construct validity, and etc. But today I will focus more what we use a lot about content validity. When you design the scenario or the simulation, you have to have validate for your simulation to make it more quality and effectiveness. And the third part, I will explore about reliability. How to achieve consistent scoring across different students, lesser and days. I think this one very important. After you design the simulation or scenario, you have to implement for reliability to prevent students bias. You are as the leader, you have to make reliability for every student or even the different time, different day. You have to make the consistency for the assessment of our students. And the fourth and the final part, I will cover the documentation. This one is like the administrative and educational paper required to secure accreditation, protect faculty decisions, and support student growth. So this one about my content for today. Let's start with the simulation design and standards. My question is, why does this matter so passionately in nursing? Why standardization matter? I think because without a structure, standard design, clinical simulation quickly deteriorate into what I call unrepeatable clinical theater. Okay. That means if a student enter a room and the scenario changes based on how the facilitator feels at that time, we have no scientific baseline. For my experience, many facilitators, they confront with a good student or the excellent students, and they can did very well in the simulation room. So the faculty would like to challenge those of the students, so they increase more complexity of the scenario. So that one, I think, is not a good idea for the facilitator. You have to follow the plan. What do you would like to do according to the objective of the scenario? So in that behavior will create an unstandardized threat, as you see in the right-hand side. This one will lead to grading disputes, shatter psychological safety. As you know that the psychological safety is very important for the simulation-based learning in every step from briefing, scenario learning, and debriefing process. You have to implement how you can make our learner comfortable in our simulation learning. And also for the unstandardized threat, it will destroy our ability to track failure. Our students are actually ready for the bedside because most of the time, for my experience, I will use the simulation-based learning for preparing our students before they go to have the real clinical practice in the hospital to let them ready to see like the real patient. So you can look at these three critical failure that not meet the standard when you create the scenario or the simulation design. The first one, assessment bias. In this one is a subjective grading overlay structure rubrics. We have faculty say sometimes that I know a good nurse when I see one. That is not the psychometric science. You not just our learner from the past experience, but you have to access upgrading our learner in the current situation that they practice in the simulation room to make it more, reliability on consistency according to their performance. And the second one, we call scenario drift. This one, a facilitator as an unplanned complications miss scenario because a student is doing too well, completely altering the cognitive load. This one, as I mentioned before, you would like to challenge if the student like did very well, so you will make more complicated of the scenario. So I don't recommend you to do this one that we will call scenario drift. And the last one about the metric failure. If every line is unique, the data is useless. I can say like this way. So we cannot track program quality over time. We must standardize to protect our student and our curriculum. As you use the simulation-based learning, you have to standardize to make our learner meet the objective and ready for taking care of the patient in the real world situation. So in this infographic, it is like the INACSL standard of best practice. In this one, to combat this crisis, the INACSL published the Healthcare Simulation Standard of Best Practice, or SOBP, as I mentioned before. And this infographic highlights the simulation standard is still related for the next part that I will talking about validity and reliability. But in this slide, I will talk briefly what is the criteria of the simulation design according to the INACSL standard. But in the validity part, I will go in detail how you make validations of each criteria according to this infographic. So according to this criteria, a valid and reliability simulation doesn't just happen. It is requires a rigorous multi-step structure process. So at the beginning, we must decide in consultations with subject matter experts. What I mentioned, what is the meaning of this one? Especially for the beginner of the simulation-based learning, you don't have more experience when you design for the simulation. You have consult with the simulation expert to make your simulation design more effectively. And after that, you have to conduct a formal needs assessment. When you design the simulation, maybe you have to review what is the literature review talking about the gap of the simulation, or you can talk with your colleagues in the simulation center or in the university, what is the student gaps of knowledge that we have to close those gaps, something like that one. And after that, you have to make the construct clear, measurable objectives. When you're writing for the objective of the scenario, you have to thinking about SMART objective. SMART is the abbreviation to writing the objective. So I think most of you will be familiar with SMART objective. And after that, you have to align with the modality that you have. And actually, when you're writing the objective to let our learner meet those objectives, you have to thinking more what is the modality or the simulator that you will use that is appropriate for the objective. It is better like high fidelity mannequins, or sometimes if you would like to assess the students uh, health assessment like a taking history, maybe you have to use the standardized patients, or sometimes you use like virtual reality. It is directly with those objectives in your scenario or the simulation designs. Furthermore, we must plan a structured pre-briefing. This is very important. For the pre-briefing consists of preparation and briefing process. So you have to do that one. And then you have to thinking about learner-centered facilitation approach. I think this one is quite difficult for the beginner of the facilitator, but if you have more experience, it's be very easier for you to act as like a facilitator. And also you have a formal debriefing process. Yeah. And after that, you have to implement for the pilot test before the scenario is ever used for your student evaluation. So I can say that every step in this field is a safeguard against variance. So that's why the INACSL implement for the simulation design standard of best practice that we have to follow. For the next part, I will be talking about the simulation validations. When we talk about validation in clinical simulations, we are fundamentally addressing three key dimensions. The first one, the appropriateness of measurement. So we must ensure that the tool, checklist, the assessment that we use in the simulation, and also the scenario we use are truly appropriate for the specific educational level and clinical focus of our nursing students. For my simulation center, actually for the assessment, we divided into two types. The first one, the formative assessment, and the second one, summative assessment. Most of the time, we will use formative assessment during the practicum, and actually, we don't give a student score because we would like the student to know the gap of their knowledge and practice. And we think that the student can enhance their performance according to our assessment. But for summative assessment, we will use after complete the course. And actually, we will use OSCE. I think Dr. Jaideep already told about the OSCE assessment before. So for the two types of the assessment, we use a difference different tool. For example, for the formative assessment, most of the time we will use a checklist or rating scale. But for the summative assessment like OSCE, we will create for rubric scale that is more, more detail about the assessment of our student, because for the OSCE that we have to give the score for the student. That's why we choose like the rubric assessment. For the second one, the core psychometric definitions. Validation is the degree to which a test or assessment to measure exactly what it is support to measure. It means that we are preciously hitting our target construct, which is nursing competence, rather than confounding factors like student technical confusions or communication nerves. So this one, you have to thinking what is the main competency of our student that you have to measure and you have to validate it. And the last one about the predictive value. For the validation, look at the ability of our evaluation result to accurately predict real-world clinical performance or professional competence at the baseline. So this is the definitions of the validations that I would like to tell you. And when you look at this slide about the measurement science, the purpose of the validation span two vital domains. The first one about the educational quality, and the second one about clinical practice safety. So I will talk about the educational quality first. From an educational standpoint, a validation guarantees that our clinical scenarios, physiological transition like a vital sign or some physiological change of the patients, and also the student evaluation pathway reflects sound evidence-based principle. It eliminates arbitrary grading pathway and educational noise. So this is a purpose for education side. For another side, about the safety standpoint, the rigorous validation ensure that a student's performance in the simulation loop accurately correlate with their safety milestone at the actual hospital base site. We must verify that our simulation tests clinical competence, not a student ability to guess what the instructor wants. So this is very important one, because we would like to prepare our student in the simulation room, and we hope that they don't mistake with the real patient in the clinical setting. But most of the time, when we provide the briefing for our student, we will tell them that you can make mistake in this room, and this one not dangerous to the patient. But you have to learn from those mistakes and not make the mistake again with the real patient. That's why we implement the simulation-based learning before our students go to the hospital. And next, when we talk about the validation in simulation, we look at three core types of validity. The first one, actually, I use this one a lot in my university. It is like about the content validity. For this one, is we verify that the nursing scenario that you create actually cover essential clinical milestone and represent clinical reality accurately. For example, your lab values, medications, and physician order realistic for an adult patient with some diseases that the student will confront in the real clinical setting. I use this one a lot, and actually from my implementation, I will invite the expert according to the scenario that you design, and let them sit together, and they will critique the detail of the scenario step by step. I know that this one is quite take a long time. Sometimes for one scenario, we will take about 4 to 5 hours. But at the end, your scenario will get better quality. And when you implement with the student, it will be more effective for our student. So that's why I recommend you to implement for the validity, especially content validity. For the second one, we will call construct validity. This is the two ability to differentiate between level of expertise imperatives. What does it mean? It is a validate simulation assessment tool should clearly difference between a novice first-year student, a graduating senior students, and expert listeners. If all three groups get the exact same score, your tool lack construct validity. Because in the definite level of the learner, we think that they can perform more, because like the listener, they have more experience, they can perform more realistic when they perform in the simulation room. And we have to think about the construct validity for the different level of the learner. And the last one we will call criterion validity. This establish a statistical relationship with real world outcome. What does this mean? It is for example, like does a high score in your simulation scenario predict success on licensing examination of your student or safer medication administration at the bedside? So this is the main meaning of the criterion validity. About the design verification step to implement this, we map out our verification activity directly onto our design phases. So during the needs assessment, our verification activity involves a deep literature review and historical safety audit to ensure the skill gap we are targeting is real. So during the needs assessment phase, you have to review a lot and thinking about the gap of our learner. And then during the scenario script phase, we must establish standardized physiological rules. We verify this by conducting a subject matter expert or SME. We would like the expert to reveal our scenario, and then we have to calculate for the content validity index or CVI. But honestly, for my experience, I just implement for the content validity, but very few that I conduct for the content validity index because it's quite take time and complex. So that's why I did only the content validity. And the next one about the evaluation design phase. We would like to build our grading instrument and verify them using interletter reliability that I will talk for the next part. So actually, for my experience, when we create the scenario or the simulation design, I also implement for the interletter reliability to prevent the student bias, especially when you use the same scenario with the various faculty members. So you have to perform the interletter reliability to ensure that the design is mathematically checked at every milestone. Yeah, this is the about the content validity index. Actually, the next part maybe I will give the different score of the CVI in the different assessment. Maybe the accepted CVI is different. So maybe in this one I will talk to you for the reliability part. So for the pilot testing protocol, in this one, you should never run a high-stakes simulation for a grade without piloting it first. So before you implement for your simulation design, you have to pilot. Actually, in my university, we call alpha and beta tests. So maybe I don't want to go in detail what is the alpha and beta test, but this one is a process that we will call the pilot test of the scenario that you have to implement before you did with the real student in the simulation room. For our protocol required for 4 steps. The first one, the timing calibration. So we have to run the scenario with dummy learner or a pilot group to confirm the timing is realistic and doesn't cause artificial cognitive overloads. So we have to thinking the scenario that we writing is appropriate that you set the time. Actually, in Thailand, when we provide the training for our faculty member across the country, we will say that the appropriate time for one scenario should not more than 20 or 25 minutes, because more than 25 minutes maybe will make the student cognitive overload, and maybe they don't want to learn more. And the second one, we have to pilot because we would like to see the crew verification, or sometimes maybe you will use like a trigger, prompting, something like that one. This one very important to ensure that when the mannequin blood pressure drop, the program crew and the diagnostics data trigger the expected nursing action. We will use crewing a lot when the student not meet our scenario or not meet our objective, to let the student more performance during the simulation time. So we have to crewing or trigger them to let them can do according to our scenario plan. So you have to check for the crewing verification. And the next one about the confidence standards. When you use the confidence, you have to ensure that your confidence will deliver uniform response without giving away reading hints. So this one very important, because sometimes the confidence will trigger the different group of the student in the different ways. So this one we will call also the bias in the simulation. And the last one, the instrument alignment. We have multiple faculty members grade not the pilot run simultaneously to check for alignment before launching the active student deployment. So we have to check the simulator equipment that is ready for the student to practice. If the simulator or the equipment is not ready, the student will waste a lot of time to use the simulator or to find the equipment in the simulation room. So we don't want to waste time like that. So right now, let's look at an empirical tool for evaluating the simulation scenario. According to this one, I use the validation way of Mujili and colleague in 2023. So this tool gives us a clear checklist to validate our scenarios across 10 vital domains. But this one, maybe I will give you in detail what you have to validate in 10 domains as like the component of the scenario design. So let's move through the first one, the learning objectives. So we must verify that our objectives are written in SMART format, as I mentioned before, and utilize appropriate action verb from Bloom taxonomy. So I think most of you will be familiar with the Bloom taxonomy. So you have to write objective according to that one. And we have to have pre-reading materials must tightly align with these objectives. So actually, when we before we implement the scenario we will let our student have like the preparation phase. For example, if you would like to implement for the stroke scenario, we will let our student to reveal the guideline of the stroke, or let them see like the YouTube about the stroke nursing care, something like that. So this one we will call like the preparation phase in the simulation. And the next one, the target group. In this one, the prerequisite knowledge must be clearly stated. So most of the time when we will implement the simulation-based learning, that means the student will have knowledge before. So we have to provide the theory in the classroom, and then we would like to see they can apply the knowledge to the practicum or skill or not. So the student should have the knowledge before go through the simulation-based learning process. And also the faculty to student ratio must be match-based practice. I can say that at the beginning of my experience, I let like 8 students for one group into the simulation room, because in Thailand, we have the regulation from the nursing council for the practicum that one faculty member per 8 student is not exist 8 student. So when I let the student go through the simulation room, I let them go through like the hall to help together. But the one thing that I see that the student will get the different experience, because just a half of them will implement during the simulation room practice, and half of them just stand, just stand around the room and they cannot do anything. It doesn't mean that they cannot do it, but a lot of the students, so they don't have a chance to implement something that they're thinking about. And right now in my university, for one scenario, we just let like maybe 4 students together in the simulation room, and we can see that all of the students can help together and nobody just stand, something like that one. So the ratio of the faculty members and the student in the simulation room is very important to let the student can learn in the same way and the same experience. And also you have to thinking about the critical action must align with the professional competency. So when you design for the scenario, you have to thinking what is the program or the course competency that you need the student meet that competency. And maybe you have to align with the hospital regulatory or some guideline or some best practice that you can write in the scenario. And the important one about the culture. So when you design the scenario, must comply with the local healthcare regulation, as I mentioned before. You have to know about the nursing council regulation, what the nurse can do, what the nurse cannot do. Yeah, to let the student learn what is their role and responsibility. And also you have to thinking about the patient demographic should accurately reflect the local population we serve. This one about the multiculturalism, or the different culture. I think in Thailand or India, in the different region, they will have like different culture. So you have to thinking about the culture when you're writing for the scenario or simulation design. For the scenario case, in this one, I mean that for the baseline clinical data, such as like demographic or anthropometric measurement, for example, weight, BMI, or the medical history, current health status, and physical exam finding must be fully articulate. So this one very important, that when you write the scenario should be accurately. And then the scenario narrative briefing. In this one, for the briefing sections, You must explicitly address the psychological safety, as I mentioned many times. And also you have to thinking the confidentiality agreement and allow adequate time for orientation. So in my university, we have the confidentiality agreement every semester with our student, because when they practice in the simulation room, sometimes we take a photo, and in the simulation room there we have the camera. So this one is, the confidentiality, or the something that, the thing that, especially for the student, that those the mistake one, they don't want any person to see that behavior. But we let explain them before they sign the agreements. Yeah. And also you have to make, like, the briefing process effectively. Actually, we have the step for the briefing, but you have to thinking about the psychological safety, that you have to did it more during briefing process. For the scenario complexity, uh, for the clinical distractor must be calibrated so they do not distract from the primary objective, matching the learner educational level perfectly. So I think when you write the scenario, you have to thinking about the level of the learner, and the experience of our learner. It should not be more complexity, and then this one will be the barrier for our student when they practice in the simulation room. And you can see like the scenario 4. So for the patient, parameter must be aligned with the initial case and progress logically based on the learner actions, which clearly prompt built in for the student who step out. So this one you have to see the flow of the scenario that you write, because in Thailand for writing the scenario we have like the state, like state 1, state 2, state 3, and all of the states should be aligned and realistic, something like that. And for the progression must be remain realistic. The scenario should not exist, and as I mentioned before, about 25 minutes, and the expected actions must be incorporated and identify critical safety steps. So for the critical point, if the student don't do it, maybe you cannot pass for the next step or the next stage, something like that. And for the fidelity, we must validate physical fidelity. For example, like the room, moulage, and equipment setup, as well as conceptual fidelity. That means the physiological data match the medical diagnosis, and the standardized patient script must be ironclad. So this one is a fidelity or the realistic of the simulation. For the debriefing process is the most important process of the simulation. So the debriefing method must be predefined, and the debriefer experience must be matched the complexity of the scenario. For example, if you use the scenario quite complex, maybe you need more experienced facilitator to let the student can get more experience. And the time allot must be sufficient for effective learning. Actually, in Thailand, when we training for the faculty member, we will tell them that the debriefing time should be 1 to 2 times of the scenario learning, depend on two things. The first one, the level of the learner, and the second one, the complexity of the scenario. So this is like the debriefing time set up. And the last one, the assessment. So the assessment for the rubric must cover like cover our objectives, look at the observable and measurable behavior, and should be clearly outline the grading system, and ideally use a validate tool. So in this one about the assessment, before you implement with the student, especially for the summative assessment, you have to validate and reliability checking. Yeah, because it will make the bias for our student. For the next part, I will talking about reliability. This one about the definition of the reliability. Reliability refers to the stability and consistency of evaluation score across different iterations. It demands that our simulation metric measure actual nursing competence rather than random facilitator bias or environmental variance. And another meaning of the reliability dance is a vital link between validity and reliability, because when we implement it, we will implement both validity and reliability. While validity is about accuracy, reliability is about precision. An instrument can be reliable without being valid, but it cannot never be valid if it is completely unreliable. I can say like that way. If a student score fluctuates widely depending on which faculty member is watching them, the entire assessment structure collapse. So reliability gives our grading scientific integrity. So if you see this scatter plot on this target, this one represent raw reliability, which is dangerous for student assessment. So you will have like many letter, you will have like different time later. So the scoring maybe is different. So this one is not good for the student in the assessment way, something like that. Yeah. And for the reliability definition, that in this part we were talking about the conceptual consistency. It means that when you giving a score for the student, it should be consistency. It's not have the bias for our student, and it should be linked between the validity and reliability, as I mentioned before. And to achieve high reliability, we must ensure repeatability across 4 core areas. The first one, the standardized script. So the facilitators must be exactly pre-written phrases, no impromptu hints or shifting language. So what you write in the scenario, you have to follow the scenario that you plan. And the second one about the environment replication. For the bedside, medication card and lines must be set up identically for every single student team. That means the environment in the simulation room should be the same, even in the different group of the student. And the next one, the actor standardization. If you use the standardized patient, they should deliver the exact same behavior cues on the exam same timeline. So this one very important for the standardized patient consistency. And the last one, the trigger automation. We should program the high fidelity mannequin physiological step directly into the software, ensuring the patient respond identically to student intervention across all groups. So this one talking about the trigger and cueing or prompting. In our simulation center, we track 3 main reliability domain. The first one, the interletter reliability that we use a lot in our center. For this one, to ensure that 2 independent clinical letter watching the exact same student, simulation will assign the matching score. This is critical for preventing grading dissatisfaction. Most of the time, our faculty members said that how many letters that you have for the interletter reliability. If you have more faculty member, that is good. But if you don't have enough faculty member for the interletter reliability, the minimum should be 2 persons. Yeah. And for the second one, intra-letter reliability, this ensure that a single clinical evaluator score a specific performance consistently. Whether they grade it at 8 a.m. on Monday or 4 p.m. on Friday should be the same. And the last one about the internal consistency. This measure how well the individual item within your rubric correlate with one another to measure the target competency. So we often measure this statistical using the combat alpha coefficient. This one about the statistical one. Yeah, this one, the interletter target metric that I mentioned to you before. If you use the assessment in your course, this one we will call low stake. So the reliability score should be more than 0.7. But if you use for the exit exam, for example, in Thailand, the nursing student before they graduate, they have to take the exit exam by using the written paper and also OSCE. So this one we will call medium stake. The reliability should more than 0.8. And for the high stake, in this one in Thailand, for the medical student, when they take the license examination, they also have to have like the OSCE examination. So for the accepted reliability should more than or equal 0.9. Yeah, that one just for your reference. Yeah. So to maintain this high metric, we must actively combat for common letter bias. I think this one you will know about some word, for example, halo and horn bias. This one occur when a faculty member general impressions of a student past classroom performance. So they will grading not according to the current performance, but they will grading according to their impression in the previous time. So this one is not good. And also the second one we will call cognitive fatigue. This one is like the letter precision drop significantly during back-to-back testing section. If you have like the OSCE for the whole day, at the beginning, you as a teacher is very active, so you will give like the assessment very accuracy. But in the afternoon section, you feel very tired, very sleepy, so your score will be maybe it's not accuracy. So this one we will call the cognitive fatigue. And the third one, severity and leniency. This one, we all have faculty who are hawk, who grade incredible Hoshi, and Dove, who give everyone an A. So they will very, very kind teacher, and they will give every student like a very high score. Or some teacher that is very strict, they will give very low score for all of the students. Yeah. And also the last one, scenario deliberately drift. That means the facilitator author that turn over several hours of running the same scenario. So regular auditing during the day keeps everyone track. So in Thailand, as the INACSL Thailand League, we provide the training that we will call scenario writing and validation workshop. And last week, I also provide the training for the university in Thailand. And also we have the OSCE workshop. In both workshops, they will implement for the validation and reliability of the scenario and the simulation design. So this is the example of the OSCE workshop. We will give the lecture, and then we will have the content validity in the group, because all of them they will have the same field, so they can critique for the scenario. And then we will have the alpha test. That means the trainee will be act as a student, and then they will perform in the station of the OSCE, and they can adjust for the scenario that is not smooth, And next, we will have like the beta test that we invite the real student. They don't have any, OSCE examination detail in each station before, and then they will go in each station. And after that, we will have, the suggestion or the comments for the OSCE workshop, something like that one. So we implement the validity and reliability in this workshop. And this is the way that we conduct for the reliability by using Excel. Actually, you can use the SPSS, but it's more complexity. So we will use the simple one, Excel, that we will have two letters and they will give the score and they sit, in the different sitting, and they will give the score according to the student performance. And at the final, they will see their, inter-letter reliability in the yellow one here. So sometimes it's very high, sometimes it's very low reliability, something like that. And the last one about the documentation. So I have just 8 minutes. So for the documentation in simulation serve as a dual purpose. It both the educational, recording, and administration groups. For the educational side, we use the simulation to teach students standard clinical charting. So, in our simulation center, the student practice in the hospital. So sometimes we get the permission from the hospital. You use some documentation, for example, like the health assessment form, some vital sign record or something like that one to let our student familiar with the document in the hospital. Yeah, and also when the student in the final year, they have to practice in the administration course. So they have to learn how they can report to the multidisciplinary team, especially for the medical doctor. They have to practice for the ISBA standard, something like that one. For the administration side, documentation serve as our evidence trail. It protect our faculty decision during student appeal, track scenario revision, and comply the calibration prior that prove our instructor are trained and aligned. So we have to keep all document in our simulation center, and we have to revise, if you have like, the new guideline or new thing, you have to revise your documentations. So right now, actually this one I already mentioned at your simulation center that we have like some video record or, some camera. So you have to keep it confidentially. And I don't know, like maybe many faculty member asked me, you will use video record for the debriefing process or not? I say that it's not. Because like you take quite a long time to see and to what is happened during the certain period that you would like to discuss with the student. And sometimes it's not psychological safety because some student is not good performance, and they would like to ask a friend to see their mistake one, something like that one. But for the confidentiality, you have to explain to the student and ask agreement for the video recording. Yeah. And also for the debriefing, pre-briefing and psychological log or of the document, you have to make according to your simulation center policy, and you have to keep all of the pre-briefing and psychological safety log confidentially. Actually, in our simulation center, we will have the pre-briefing format, and this one very important for the beginner facilitator. They're not confident how to provide the briefing process for the students, so they can take a look from our format. But for the experience for the facilitator, maybe they don't want to use that. And if they have some updated guideline, maybe we can update in our document. Yeah. And also you have to have like your standardized reviewing process. I think you know that we have like many deriving model, for example, gas, pearl, diamond. But in my simulation center, we use the simplest one is a gas model that is very easy for our faculty member, and in my idea, is very effective for the gas model right now. And for I'm not sure. Maybe some of you here thinking about the accreditations of your simulation center, but I'm not sure. Like in India, you will have like some organization for the simulation center accreditation or not. But in Thailand, we don't have it. So most of the simulation center will accredited by Society for Simulation in Healthcare from the US. So in my simulation center also we have like that fund, but the one thing that you have to concern about the budget is quite high cost for the accreditation. But I think it's very good to make your simulation center more standards. So if you're interested, you can go to SSH website for the accreditation category, something like that. And for the INACSL Thailand League, we have a lot of the activity. Like last month, yeah, we just have like the first international annual conference. Actually, we have the conference every year in Thai and the international one. Last month, Dr. Jaideep also joined our conference and the speaker, and Dr. Ashley from the US, and various speaker who are expert in the simulation come to our conference to update the knowledge and the experience about the simulation. And before our annual conference, we also have the simulation contest for the nursing student across the country. This year is the first time for our INACSL Thailand League, and at the first round we have like 61 team around the country, and then we have the semi-final and the final round. The final round we have like 8 teams all together in the venue, and here we have the competition. This one is very good opportunity for the facilitator and student, because our competitions will start from the briefing. That means the competitor don't know about the scenario, and then they will give we will give the scenario 1 hour before they start on the stage. And then we would like to see the facilitator skill from the briefing, learning scenario, and the briefing process. So it's very challenge both for the facilitator and student. And also we provide various courses about the simulation for the faculty members across the country. Actually, in each year, maybe we have like 40 or 50 training across the country. So in this today also we have one team of our committee provide the sim basic course in one university in Thailand. So thank you so much for your time. So if you would like to reach out to me by email, you can see from this slide. I'm very appreciate if we can have some collaboration in the future. Thank you very much. If you have any question, please feel free to ask me. Thank you. Maybe you don't open the microphone. Sorry, like you had to unmute. Sorry, because I cannot hear you.
Okay, so now you can hear me, sir?
Yes, good. Thank you.
Okay. Thank you so much, sir, for your presentation. And I would like to the participants and the audience to ask the question to the sir if you have any doubt or questions. We'll wait for a few moments. No questions? But I do have a question, sir, for you.
Yeah.
Sir, what are the most common challenges nursing colleges face when trying to establish reliability among the multiple assessors during the simulation-based assessment? Like, what challenges they used to face it, sir?
So for the challenge that maybe at the beginning they don't understand like what is the simulation look like,
Okay.
actually how we can create the assessment. And the one thing that is very, I think is this one is barrier for our faculty member. Actually, when we have like the validity and reliability process, and after that we sit and discuss together about our assessment. But when they go to the real situation to assess the student, they still have their own idea. They
Oh,
don't
yeah, yes.
follow what our agreement. So we have to make more and more effort for that challenge.
Yeah. Thank you, sir. I one more question is there, sir. That the for the new simulation based assessment and have like for them, do they have a limited resources? What would be your recommendation for ensuring the validity and maintaining the proper documentation practices, sir?
That is very good questions because when we provide the training for the faculty member in Thailand, we say that simulation is a technique, it's not a technology. So maybe if you don't have any limited resources, for example, you don't have any like high fidelity mannequins, you don't have virtual reality, that is not matter. So you can use what you have, like the low fidelity, and you have to thinking the important one that how you can create the scenario that meet the objective of the student, and we can enhance their competency before they go to the hospital.
Okay.
Yeah, I think in Thailand, especially for the rural university, they don't have enough budget or enough resources for the
Okay.
simulation. We're thinking about the sharing resources, but I think it's quite difficult, even
Yeah,
the
yes.
simulator, but for the transportation, how they can, go to the simulation center, that is also the barrier. Yeah.
Thank you so much, sir. Any other person, like any other audience, want to ask any question? Like, do you have any questions for sir? I think no questions. Okay. Thank you so much, sir, for your valuable insights and the practical recommendation with us today. We sincerely appreciate for your time, dedication, and willingness to support the nursing educators
Jadi,
through this
tapi
webinar.
terlonjak.
So I think some mic has been on, so you need to.
Terlonjak.
Okay. So, on the behalf of the INACSL North India region Vidyanta and all for our participants, I extend for the heartful gratitude to you. With this close to the end of today's session and the completion of webinar series assessing competence through simulation-based assessment for the nursing colleges. Thank you to all the participants here for the participation and the engagements and very soon we will be back with our next webinar series. Thank you once again for joining us and have a wonderful day ahead. Again, I want to ask if do you do have a question you can ask before leaving. Like, still will give you some time. If you do have, you can ask the questions to sir again.
Ma'am, I have one question, ma'am.
Yeah, you can ask to sir. Yeah, sir is here only. Yeah.
Yeah, ma'am, sir, like reliability, as reliability was speaking, like scenarios, we can give this scenario, same scenarios to the for different like batches, same scenarios can be used for the simulation base. Like for the students, we can use for like we will take for simulation for one group like 10 members means next group we can give the same scenarios can be administered for the students or what, sir? It gives a reliability towards this, sir.
Uh, okay. Thank you for your questions. You can use the same scenario or not, depend on what type of the assessment. For example, if you use like formative assessment that you actually for the formative assessment, we would like to enhance the student performance. So we don't give any score. So you can
Yes, yes.
use the same scenario. And for my experience, it's very good. Even the first group of the student perform the simulation, and then maybe I can say that the student will tell what happened during that one for the second group. I think this is very good for them to prepare. For the second group, maybe they will confront with this situation. They will read more information before they go to the simulation room. Something like that. It's a good trigger for the student. But for the summative assessment,
Yes, sir.
we will give the score. Actually, you can use the same scenario, but you have to have the methodology how to you prevent the student that can face-to-face together to prevent your scenario loss to other students, something like that one. Depend on your course of assessment.
Yeah. Thank you, sir. Thank you, sir.
Anyone else want to ask any questions? Like, we'll wait for a few more minutes. Like, if you want to ask, you can ask the question.
Maybe no.
I think no question is there. Okay, so thank you everyone, and thank you so much, sir, for your time. And have a wonderful day ahead, everyone. So we'll wait for the next webinar series again. We will be back soon with it. So thank you everyone for the participants also, and thank you so much to you, sir, also for your time and everything.
Thank you very much, and see you anytime. Bye bye.
Bye bye, sir. Yeah, bye.
Thank you, ma'am.
Thank you.